Migraine headaches could be debilitating. Unfortunately, there are a lot of people who suffer from daily headaches. Imagine being able to wake up with energy going through your day with no headaches. Imagine not having these headaches so you can be more productive at work and be able to spend more quality time with your family and friends. My name is Dr. Mahwah. I practice at MedWell Spine and Neuropathy Center, located in Midland Park, New Jersey. We are a panel of doctors and physical therapists working together at one location. I'm also the author of this book, How to Live Pain-Free and Happy, Drug-Free, Non-Invasive, Non-Chemical, Non-Surgical Steps for Resolving Migraine Headaches, Chronic Pain, Chronic Fatigue, Fibromyalgia. What makes us different is that we treat migraine metabolically and neurologically. The reason you're watching this video is because either you or someone else is suffering from migraine. The purpose of this video is to inform you what is available and enable you to be able to enjoy life with your family and friends to the fullest, so you can live in this planet longer. What if I tell you there may be a painless, non-invasive, non-chemical, non-surgical solution to your migraines? What if I tell you information that pharmaceutical companies don't want you to know? So I want you to listen carefully. You can grab a pen and a piece of paper as you wish and write down some of the information that I'm going to be going over. There are two types of migraines, classical and common. Classical is a migraine that follows an aura or some type of spontaneous event, which is called prodrome phase. Common migraine does not have an aura. Usually people suffer from common migraine as opposed to classical migraine. In fact, the ratio is about 3:1. Now, in your brain, there is a part called the brain stem. It has upper, middle, and lower. When the upper part of the brain stem is overactive, it causes your headaches, it causes your migraines. Because the blood vessels in that area gets inflamed. It causes the neurons in that area to cause the blood vessels to dilate and constrict very rapidly. And as a result, it causes inflammation around that area, and that stimulates that area and causes migraine. You may also get digestive problems, sleeping problems, so that is why you experience the symptoms, because of the overactive upper brain stem. Now when you have an overactive upper brain stem, which is called the mesencephalon area, the loop that goes through the signals, it doesn't work properly. Just to impress you, the loop is called neocortical thalamo-hypothalamo-pontomedullary reticular activating system. It took me about 3 years to be able to say that. Because the treatment that we do for that area of the brain is to slow down the upper brain stem, the mesencephalon area.
Hi, my name is Vicki Gillenbardo, and I've had migraines my entire life. I could never concentrate, I can't spend family time, so I found out about Dr. Mahwah through my local doctor and from a local paper. And I have been coming here for about 3 visits. I have not had any headaches whatsoever. I can't thank Dr. Mahwah and your staff enough. Thank you so much. I feel absolutely amazing. Thank you again for everything you've done for me.
I know what you're going through, and if you don't treat it, it will potentially get worse. One of the factors that causes migraine headaches is stress. Stress has definitely something to do with migraine headaches. Now, stress could be physical, chemical, and emotional. An example of a physical stress could be a car accident. An example of a chemical stress could be alcohol or tobacco use. Example of emotional stress is work-related. If you have been abused, if you have been sexually abused, if you're verbally being abused, or, for example, if you have had episodes of divorce or bad relationships. What stress does is that it causes the body to release cortisol. Cortisol, it gets released from your adrenal glands. Adrenal glands, they're glands on top of your kidneys. Cortisol is toxic for your brain. That is why, while you're under stress, you may not be able to think straight. You have trouble with your memory. You get to a place you don't know how you got there. Hundreds of migraine sufferers have been helped without the use of drugs, utilizing brain-based therapy. Unfortunately, migraine sufferers are prescribed lists of medications, Imitrex, Topomex, or even anti-seizure medication called clonazepam. It is a Russian roulette of drug therapy. My experience has been the medication will wear off and you will get used to it. The treatment protocol that you will hear has helped hundreds of migraine patients during the past decade successfully.
I've been here for only 5 visits, and it's the first time I can say in years that I am pain-free.
I have studied over 10 years of latest research in diagnosis and treatment of these series of conditions. I'm also trained by the country's leading expert, Dr. Michael Johnson. What makes us different, once again, is we diagnose and treat migraine metabolically and neurologically. You do not want to leave any stone unturned. Our goal is to investigate the true cause. We define what is the true cause. Is it metabolic? Is it neurological? Or is it, in most cases, both? We design a diagnostic treatment plan that is second to none to find the underlying cause of your migraines. We deliver the treatment plan that is second to none, that is drug-free, that is non-invasive, non-chemical, non-surgical. There may be certain lab tests that needs to be done to assess the true cause of the problem. This is the part that is commonly missed.
I've had pretty much problems with headaches in my past, and it's not like me to actually do a video, but I have to share with you the results that I have done with coming to Dr. Maz. I've been here over a month. I read his book, and it has helped me so much now that I pretty much don't recall me having a headache.
If you have an autoimmune condition, you will not get better. And that could be the reason why you're not better. If your immune system is being attacked and not get treated, you will not get better. There's a good chance that you will not get better. You may need a blood test. We have to do a complete blood count. We have to do a thyroid panel, blood chemistry, lipid panel, complete metabolic panel. The reason we have to do all of this is to find out how your body is functioning properly and how your body is not functioning properly. I guarantee you that you have not had all the tests done that I'm about to tell you. With the blood tests, there is lab reference ranges and there is functional ranges. What I mean by that is, when you look at your lab results, we look at them carefully. Why? Because the lab ranges, there are a lot wider than the functional ranges that we look for. Functional ranges, they are much more narrower. For example, if an item on your lab report should be from 75 to 100, that is normal, there should be a difference between 76 and 99. That is why there is functional ranges that are a lot more narrower. The next test that we may order for you is sensitivity test. It's a food sensitivity test. If you have sensitivity to gluten, egg, milk, soy, or yeast, you will not get better because that will be attacking your immune system, and that could be the reason why you're not better if you have been treating your migraine headaches and you are still getting migraine headaches. The only way that you know if you have food sensitivity is to get tested. You as a patient may say that I have no food sensitivity, but I'm telling you the only way to find out if you have sensitivity to food is to get tested. For example, people have a heart attack today. Yesterday they didn't have any symptoms. Does that mean their heart was okay yesterday? Absolutely not. Same thing with bone density. If they fall and break a hip today, yesterday, does that mean their bones were okay? Absolutely not. They're brittle. They go through stages. Some of it with symptoms, some of it without symptoms. You may need to have a stress index test. It's an adrenal stress index test. The reason for that is because adrenal glands, as I told you, they produce cortisol. Cortisol production should be at its highest in the middle of the day at about 3 p.m. and at its lowest at 3 a.m. in the middle of the night. If your cortisol production is the opposite, you're going to have a problem. You may not be able to sleep, and that is the reason that a lot of people can't sleep. Their cortisol level production is at the wrong time. So by doing adrenal stress index test, we get to the bottom of it and we treat it nutritionally and with brain-based therapy. You may have a H. pylori, you may have a leaky gut syndrome, you may have a parasitic, bacterial, viral infection in your gut that is attacking your immune system and make you not to feel better. So how do we treat migraine? We treat it metabolically and neurologically. This is the treatment phase now. Unfortunately, migraine patients have to play a Russian roulette. They go to their doctors, they're given medication. If this medication doesn't work, try this one. If that doesn't work, increase the dose. Or sometimes patients tell the doctors, I saw a commercial on TV, what do you think about this medication? The doctor says, try it. It's new. Latest research. You ready for this? Latest research shows America has 5% of the population of the whole entire world. But it consumes 50% of the medication that is consumed in the entire world. That is shocking to me. So out of all the medications that is consumed in the entire world, half of it is in the United States. Some doctors, they give you trazodone. Trazodone by itself could cause a sleep problem. I'm not telling you to stop your medication, I'm telling you to investigate it so you know what you're getting yourself into. Our treatment is geared towards slowing down the upper brain stem. It will be hands-on physical therapy. It may be olfactory stimulation. It may be eye exercises. You may go on the upper body ergometer and brain-based therapy. Now, what is brain-based therapy and why brain-based therapy? Brain needs two things to survive: fuel and activation, energy and proper amount of signals to work properly. Now, the fuel part has to be glucose and oxygen. So, glucose and oxygen is necessary for brain to work properly. Glucose is handled metabolically from what you eat. Now, oxygen is extremely important because brain does not store oxygen. Your muscles do. Your brain needs constant amount of oxygen flow to it so it could work properly. Now, on the back part of the brain, there is an area called cerebellum. That is the most oxygen dependent part of your whole entire body. Not your brain, your whole entire body. When cerebellum doesn't have enough oxygen, it doesn't work properly. When cerebellum has enough oxygen, it works properly. The job of the cerebellum is to make sure throughout the loop that's going through to slow down the upper brainstem. That's called mesencephalon. So if the upper brainstem, the mesencephalon area, doesn't work too hard, you're going to be good. If it works too hard, you're going to have all the symptoms. If it doesn't have enough oxygen, that loop does not work. It's called oxidative phosphorylation. Now, as you age, your ability to utilize oxygen diminishes. So as you breathe, you have less utilization of oxygen in your body. It's actually, studies show it's 1% a year after the age of 25. That means if you're 50 years old now, you have 25% less ability to utilize oxygen already. And next year, you're going to be 26%. So we are all oxygen deprived. You may go to your primary care physician, or you may have been to your primary care physician. He or she may have said to you that you're okay with your oxygen and you are not oxygen deprived. I want you to understand, generally speaking, doctors, they assess if you're oxygen deprived or not based on your cardiovascular system, not your neurological system. When I say you're oxygen deprived, it's based on your neurological system, your brain to work properly. So when there is not enough oxygen given to your cerebellum, your mesencephalon on top of your brainstem, it works too hard. Now when there is an increased output of mesencephalon, if the mesencephalon works too hard, you will get headaches, insomnia, digestive problems, chronic pain all over the body, like fibromyalgia or chronic fatigue, dizziness, visual disturbance, heart problems, recurrent urinary tract infections, and as I said, chronic fatigue. So it's a slew of problems that you may have if you have overworking mesencephalon. So we have to give you enough oxygen, so oxygen is more supplied to your cerebellum, and the upper brainstem doesn't work too hard. It is essential. How do we do that? We give you supervised oxygen treatment on site prescribed by our medical doctors. What other treatment we give you? The treatment that works. The treatment that is painless, non-invasive, non-surgical, and non-chemical. We may give you whole body vibration. We may give you hands-on, one-on-one physical therapy.
At this time, I could sleep all night, through the night, without pain meds. I don't use the cane. I just can't believe the difference between my condition when I came in and today.
You may be light sensitive. The reason I say that is because a lot of migraine sufferers, they are light sensitive. And the reason for that is the third cranial nerve, it goes through your mesencephalon area, and if your mesencephalon is working too hard, it causes your pupils not to be able to constrict rapidly to adapt to the amount of light.
Incredible the results that I'm getting from MedWell, and I know it will continue, and I tell you I look forward to my treatments, and the people here are so professional and so competent that it's just a pleasure to be here.
Guaranteed you have some inflammation in your body that you need to get rid of, because we all do. Inflammation, you may not know this, but inflammation expedites aging. We may have to give you a specific type of stretching to stretch the muscle spindle cells in your neck, Golgi tendons, and joint mechanoreceptors, because stimulating those, it causes your migraine to go away, and that's why your migraine goes away when we give you this treatment, most of the time.
He helps people eliminate pain and prevent long-term, very disabling scenarios. This is Joel Bauer. I believe in Dr. Mahwah.
You may need light therapy. The reason we do light therapy is because we have these special glasses with rose lenses and light emitting diodes. We put that on the non-dominant eye based on our neurological evaluation that you receive on your first visit. The reason we do light emitting diodes and the red rose lens is because rose and red color is the lowest in the spectrum of light, and then you wear that on 5 minutes on, 5 minutes off during your therapy. That slows down your upper brain stem. You may get visual stimulation, you may receive olfactory stimulation or auditory stimulation on the opposite side of the problem. The reason we do on the opposite side, as you know, the right brain controls the left side of the body, the left brain controls the right side of the body. So we assess all of that neurologically on your first visit. In addition, when the upper brainstem works too hard, as I said, it causes a slew of problems. And when we get rid of upper brainstem working too hard, you may have a benefit of helping your digestion so you don't get constipated or diarrhea or feeling gas after a heavy meal, heartburn, so on and so forth. So I'm giving you an alternative. I'm giving you a painless, non-invasive, non-surgical, non-chemical alternative method. Investigate it. Sometimes my patients, they bring in supplements. Now, we give you supplements as part of the treatment over here. But now, what I want you to understand is the supplements that you find on the web, on internet, I have never seen any supplement that cures a problem. They may help, but they may not cure. So, supplements, they're supplemental to treatment, the good ones. That doesn't mean they replace the treatment. Metabolically, how we treat migraine, with a slew of things based on what we find. You may need glutathione treatment. Glutathione is a natural antioxidant. It's the mother lode of antioxidants. It is the most strongest antioxidant that exists. Glutathione treatment. You may get specific supplements, as I mentioned, in addition to glutathione treatment. So ask yourself this: how is your migraine affecting you with your job, finances, relationships, family, and other activities? What is it costing you in terms of time, money, or happiness? What is it costing you not to be able to sleep? Where do you picture yourself in a year from now, in 3 years from now, in 5 years from now, if you don't take care of this? What is it costing you not to be able to do what you want to do? If you're serious to correct it, you need to contact our office. If you don't care about your health, do not contact our office. Do not waste your time, waste our time. I do not need to do this anymore. I do this because my passion is to help people to live better, and I have been fortunate that I could facilitate that. You can get treatment or not to get treatment. It doesn't make a difference in my life. Your health is your responsibility. It is not your employer's responsibility, it is not your government's responsibility, and it's not your insurance responsibility. It is your responsibility. Sometimes people who are skeptical about care, they come and tell me, Dr. Maz, can I show this to my medical doctor? Can I show this treatment program that you have to my medical doctor? And of course you can, but my response to them is, if your medical doctor knew about what I'm telling you, you would have been better by now without taking any more pills. Your doctor is treating your symptoms and not fixing you as a person. There are only a handful of doctors in the northeast of the United States who are trained in what we do. If it makes sense to you, call our office. I'm asking you permission to help you. If you're serious about getting your symptoms handled, our office is for you. Call 201-848-8000. Are you ready to open the combination of your life? You guys are all here because you choose to be here to get rid of your symptoms, pain. By doing what I'm going to go ahead and tell you to do, I'm going to enable you to get your life back. So you don't have to suffer with pain, numbness, neuropathy, tingling. You won't be able to experience chronic fatigue, tiredness. That's why we're all here. We're going to define, design, and develop a treatment plan that's going to be effective and enable to get your life back. So one more time, you can get up in the morning and you had a restful sleep and you haven't lost your mind.
I just had a phenomenal neck adjustment, which I didn't realize could feel so good. My headache is completely gone. My shoulder feels much better. I can't wait to go home and explain to my wife what exactly just happened here.
I had a lot of pain in my neck and shoulder area. And after 3 visits at MedWell, I'm feeling a lot looser. I can stand up straight, and I feel like this is the right place to get the treatment. Thank you, MedWell.
Not everyone is accepted for care. We only accept patients who we feel we can truly help. So if what we have said to you has made sense to you, then you need to call our office, and one of our new patient coordinators will be glad to help you. When you come to our office, you may get treatment the same day or the following visit, based on how busy we are. Unless you're coming from out of the state, then we give you treatment definitely the same visit. The treatment, it is painless, non-invasive, non-surgical, and non-chemical. Can we guarantee it? No. Are we successful? Yes, very successful. This is Dr. Maz saying thank you for watching this video, and I will look forward to seeing you in the future. You can call our office at 201-848-8000, and yes, we accept most insurance plans, and God bless you and your family.